Nursing with Faith. I am going to do a full review on F.A. Davis Company RNotes and why this is a must-have in clinicals. Let me just say how I feel. This book is amazing and it has helped me out so much with the quick, need-to-know information. And look at the size. I mean, this fits in my scrub pocket. This is one of the things that I recommend that you guys have. I'm just going to read the front, okay? Nurse's Clinical Pocket Guide. It includes wipe-free forms, CPR, ACLS, PALS, NRP guidelines, NCLEX tips, 12-lead interpretation, enhanced physical assessment, critical lab values, emergency drugs, patient education slash safety, medical emergencies slash trauma, and OB slash peds slash Jerry coverage, and much more. Also, this is waterproof and reusable. Now I have my handy dandy notes right here just so that I can share with you guys everything that I thought about this book. I do want to give an effective and helpful review on this book because these books are expensive. Nursing students or anyone going to school you don't have money to waste, so I really want to make sure that I jot off whatever is on my mind that I feel like this book is worth having or buying. So 5 ways how I find this book helpful in clinicals, okay? Number 1, it's compact, meaning it's small. I mean, there's so much information in this small little book and it fits in your scrub pocket. Number 2, it's organized into tabs. Now, the tab 1 is procedures, tab 2 is assess, tab 3 is lifespan, tab 4 is emergency slash trauma, tab 5 is fluids, IV, and meds. Tab 6 is lab slash ECG. Tab 7 is diseases and patient education. And the last tab, tab 7, tools slash index. So they're organized into tabs, meaning like if you are doing a physical assessment on a patient and they have COPD and you want to refresh your mind on COPD, how to care for a patient with COPD, you want to give an effective respiratory assessment, you go to the assess tab, okay, and it tells you right there, and then you're just going to find, once you get familiar with the book and where things are, which I do recommend that you do look at it, review it, find out where things are, so when you get to clinicals you can fully utilize this book. You go to respiratory assessment. It breaks the first part down into history, and it gives us a couple of details about respiratory, okay, cough, productive or non-productive, dyspnea, COPD, energy level, sleep pattern, pneumonia. It's just giving us descriptions of questions we'd ask or descriptions of a respiratory assessment. Now, certain medications that are part of a respiratory assessment, bronchodilators, corticosteroids, and then it just goes into other pertinent information, how to inspect, what to inspect, signs of distress, signs and shape of the chest, trachea for scars, stomas, etc. Palpate, what to palpate, percuss and auscultate. It goes into the auscultation of lung sounds. Now, it's important to know where you are going to locate, lung sounds, because when you have a patient with COPD or asthma or pneumonia, you want to be able to know what kind of lung sounds they have. So there you go, anterior and posterior, and respiratory patterns, tachypnea, bradypnea, and then you go down into your Cheyne-Stokes and Kussmaul's. Lung sounds are so important to know. And I'm still getting into the hang of lung sounds because it's not something that you hear every day. And when you do hear it, you learn about it, and then you'll have it with you forever. So you have, your wheezes, your stridor, your rhonchi, and you see where it says life-threatening. It really gives you need to know information like alerts in red. Sorry, it's not focusing at all. So number 3, you can actually write on it with a ballpoint pen and be able to wipe it off with an alcohol prep pad. The pages are very durable. They're not cheap. If this book is not made cheap, which I was worried about because you're spending I want to say about 23 bucks. Number 4, it has need to know information. It has clinical information in it. All my assessment tips, all my procedures, NG tube, ostomy care, airway maneuvers. It has wound care in it, and it breaks it down into bullets of what you need to know information. There's no fluff in this book. And last but not least, it has the NCLEX tips in it. You'll see a circle that's red and it says NCLEX in it. So, you know, as you're learning in clinicals, you're learning NCLEX tips as well. Okay, so now I'm just going to briefly summarize each tab so that I am allowing you guys to get a little inside tour of this book. I wouldn't say tour, but a little inside scoop of this book so that you know what you're buying. Aspiration precautions in it, like the general guidelines of what aspiration is, and signs of dysphagia, signs of a patient not being able to swallow, having a weak swallow. The first page of procedures actually goes into your pre-procedure and your post-procedure guidelines. Blood administration, what supplies you're going to need, the actual procedure, and it breaks down the blood products, okay? Assistive devices if you have an ortho patient and you need to refresh your memory on how to teach the patient how to walk with the cane, okay, or a walker. Chest tubes, how to set up a closed chest drainage system with insertion, removal, and troubleshooting. Troubleshooting, like if there's an air leak or if the chest tube actually comes out of the patient, what are you going to do? NG tube insertion, confirmation of placement of an NG tube and removal. So those are some of the things that are in procedure. Assessment, you have, you know, normal vital signs chart just in case you forget. How to assess vital signs, your heart rate, how are you going to do it, your respiration, how do you do it, your temperature, how do you do it. It gives you steps if you're a new student or you just want to refresh your memory. Pain assessment, it goes through all the body's systems, cardiovascular, respiratory, musculoskeletal, neuro. It goes through all of those assessments, breaks it down, gives you great descriptions, how-tos. It goes through the fluid and electrolytes, the Glasgow Coma scale, pupil size, and the stages of pressure ulcer and how to prevent pressure ulcers. The third tab is lifespan, so it goes through the geriatric phase, the dehydration, the delirium, dementia, depression, suicide, fall prevention. It breaks all those down. Need to know, nursing intervention, nursing prevention. It goes into your OB patients, your obstetrical patients, gestational diabetes, for example, vaginal bleeding. And again, in bullets, need to know information. What is the nurse going to do? What are the risk factors? It also has NCLEX tips. And then it goes into newborn, the CPR, newborn, and APGAR scores, also pediatric population, cardiac arrest, respiratory distress. The next tab is emergency/trauma, so it goes into CPR maneuvers, choking guidelines, defibrillation and pacing, emergency meds, which are your nitro, your fentanyl, your dopamine, with indication next to the medication. Like fentanyl is an opiate, so it's going to be for pain. That's the indication and the dosage of an emergency medication. Next is med/IV/fluids. It goes through all the administration guidelines on how to, if you forget how to, because you learn that in your first nursing class on how to do buccal administration, eardrops, and if you haven't ever done it in the clinical setting, you kind of forget. So it goes buccal, eardrops, eyes, NG tube administration, IM injections, and also it goes through the sites of all the IM, sub-Q, intradermal locations on the body. insulin. It covers the insulin, the types of insulin, and alerts, because you have certain alerts for insulin, like what not to do, what to watch out for. And it also goes through IVs, the accessing the IV, on how to access the IV, infusion of your continuous, your intermittent piggyback, and your IV push. And it also goes through maintenance on how to care for an IV afterwards. Now, the next tab, which is labs/ECG, it goes through all your basic chemistries and your electrolytes, also your blood gas analysis, your coagulation studies, your analysis, and ECG interpretation, like how to, and it also gives you pictures of the rhythm strips, atrial fibrillation, atrial flutter, tachycardia, ventricle tachycardia, VTach, and VFib, which are important to know. The next tab is diseases, and patient education. This goes over your common diseases, cancer, like a general overview of the different types of cancers and the different types of exams that you can do on yourself, the testicular exam or the breast exam, COPD, CHF, diabetes, hypertension. You know, if you have to brief yourself up on these topics, it tells you about the disease, nursing interventions, risk factors, important information, all in a small section. Also, this part of diseases and patient education, it gives you food and dietary considerations, food sources for specific nutrients, foods to avoid with certain drugs/herbs, and herb prescription drug interactions. Also, suggested dietary changes related to diseases. Sometimes you'll get a patient who has a low potassium or a low sodium or a low albumin. So you're going to have to give them foods rich. You're going to have to order a tray or collaborate with the dietitian for them to get a tray or food on their tray that is high in iron, high in calcium. Now the last section is tools/index, and this goes over cultural diversity in healthcare, American Indian, Asian heritage, Haitian heritage. It goes over how that certain ethnic group communicates and their healthcare practice, and taboos and disrespect that you shouldn't do. So that is so important to do, because I come in contact with a lot of people, a lot of different cultures, and I have to consider their aspect of health and how they view health and how they operate in the healthcare. So I highly recommend this book. It helps me a lot in clinicals, and it saves you time from having to pile up at the nurse's station with all the other students, all the other nurses. If there's no computer on wheels that are free, you have your book here. You can easily take a look at it. It can help you with so many of your patients, so many of your assignments, refresh your memory, learn more, and it has red tips in it. If it's red and has a bullet next to it, it's like an alert warning. You need to read this. If you have any questions, any concerns, any comments for me, please write it down below. And please like and subscribe for more. Bye.